gynecologist here, Dr. Joseph Lee. I visited one of my friends, my BFF, my travel friend, because most of the time I see her during our travels. No, I visit her in one of her fabulous clinic here in Makati. None other than, none other than the most gorgeous, beautiful, kind heart, everything. Uh, ikaw na, bahala ka na. Oo. Dr. Jenny Jose. So how are you? How are you?
I'm actually very good, but you know what? You introduced me so much. That's too much. Okay.
No, it's
but-
not yet.
Okay.
Because she is one of the top urogynecologists in Makati Med, in St. Luke's,
Oh my.
etc. And he has the high level patients. Now, if you just know. Anyway, so
Yes.
how have you been doing?
Well, I'm good. I'm just very excited because I have some products to share with you, and these are actually my products which I actually concocted during the time of pandemic.
Yes. But before we go to the product kasi, this is the first time, I think sometime before you have been inviting me to your clinic.
Yes,
Diba?
right.
So this is the first time I step foot in your clinic, in your wonderful... Actually, guys, hindi lang isang clinic niya dito sa Flora. Dalawa, tapos meron pang isa. Dinagalog ko para ano. But this clinic is named Pelvic Health and Intimate. I like the word
Yeah, intimate wellness.
How was it going, Pelvic
Okay.
Health?
Well, because at first I am a urogynecologist and a pelvic reconstructive surgeon, so I deal with a lot of patients with incontinence, pelvic floor issues, urinary retention, recurrent UTI. And then eventually, of course, because I'm a gynecologist, I also deal with a lot of gynecologic problems like fibroids, abnormal bleeding, ovarian cysts, and all this. And then you see, as these patients, as I do minimally invasive surgery, they told me, okay, you make me pretty up here with small incisions. Why don't you make me pretty down there?
Right.
So, they encouraged me to study aesthetics, gyne aesthetics.
So your patient encouraged you to study
gyne
gyne aesthetics.
To make
Where
them
did they
pretty.
got that idea? Yun ang gusto ko malaman, Jenny.
Yeah.
Kasi 'di ba, parang minsan sabi mo, I've done all my
Right.
stuff. I've been doing robotics, laparoscopic.
Yes.
Why gyne aesthetic? Where did this patient came
Well-
about in knowing this?
Well,
type
because
of
remember,
function?
when I do minimally invasive surgery, I have small incisions in the abdomen of
True.
the patients, and there are no scars.
Mhm.
So they said, why don't you make me pretty down there?
Wow.
And they don't want to go to other doctors. They're comfortable to their gynecologists already. And, I really feel that they should be going to a gynecologist to deal with their pelvic issues. And that's the time that I studied gyne aesthetics, and it's actually very good. And then eventually, I also studied sexual medicine too, because they're all interconnected.
Right. This has been done or being studied even abroad already.
Yes.
But
yes.
it's not yet familiar in our shores, right?
Well, but like in the Philippines
Right.
now, presently I am the president of the Aesthetic Gyne
I
Society
know.
of the Philippines.
Yeah.
And like
so you
I've
brought the
we
specialty.
we
here.
brought the specialty here, and I actually started the practice July of 2016.
Okay.
But in terms of sexual medicine, I just studied sexual medicine in Hungary last year. It's a full course, and that's why I'm practicing it right now.
Can you imagine, guys? He's so well shelved with all this diploma. Okay,
It's
I'm
actually-
tongue-tied.
No, because
no,
it's so
but I
nice.
know you because once you get into some passion,
Right.
you go and learn it and you study it.
Yes.
Even it's within Asia or even across Europe,
Right.
which we see each other
I know.
during our trips. So,
Right.
but before we go again to that, why did you make your clinic, pelvic health and this intimate wellness center?
Right.
Because
Well,
of the patients.
Because of the patients, because there is no center in the Philippines right now that caters to this, right? But what I notice is that patients nowadays are actually opening up, right? And before, maybe when you talk about sex, it is a taboo. But now people come and talk about it, and they are very, very comfortable in sharing their complaints. So I said, why should I, if I'm going to advise you, you're going to a doctor. I don't
Mhm.
like to be paid and giving you advice
Mhm.
for something like this, and it's not medical, right? That's
Mhm.
why I did my further study in sexual medicine.
Okay.
Mhm.
So besides making downstairs pretty,
Mhm.
so what are the major procedures or
Oh,
the
okay.
ones that they request to
Okay.
make it, you know, a bit
Yes.
nicer, pretty, beautiful, or
Yes.
whatever?
Well, actually, I do functional and aesthetics.
Mm.
Like for functional, I treat urinary incontinence, right?
Yes.
Like overactive bladder. We know that because we're
Mm.
both urologists. I'm a
Right.
urogynecologist. But in aesthetic gyne, of course, we make it pretty down there. So
Mhm.
what do? I offer labiaplasty. I do contouring. But you'll be surprised. Here in the Philippines, majority are asking for whitening, right?
Yes.
They want their labia to whiten. They want their groin to whiten. And there's a lot of patients who are asking this, and that's the reason. That's why I actually went into
Right.
this product
Not
as
because
well.
of the color of the pigmentation,
No.
because it was
Mhm.
already,
Well,
not
maybe
as
because
white
of
as before, or did they want to make it more whiter?
because sometimes it's because of their underwear. Let's say it's
True.
so tight, or
Right.
frequent rubbing.
Okay.
Yes, you can have all those discoloration.
So, after all this,
Mhm.
you made your product.
Yes.
So this product is made from passion, I know. Okay.
Definitely.
Can you introduce to us now each one?
Yes.
What are the products?
Well, this is my premium whitening soap. Okay, this is not like an ordinary whitening soap because this also moisturizes. And what I think is very important about this, it has hyaluronic acid, right?
Yes.
So it actually regenerates and rejuvenates the skin.
Can that be used also for men?
Yes.
Yun.
Actually, if we're gonna look at it, it says premium whitening soap, right?
Why premium?
It's premium because it has hyaluronic acid and it has 10 different whitening ingredients.
Is that an important ingredient, especially for soap?
Yes, but not all soap has this.
Oh,
Because
why?
this is the one that moisturizes. The other soaps, they don't have it.
That's why you have those sprays that you put and those creams that
Yes.
dermatologists you have to ask us to put.
Right.
Like for us, it's very lazy.
Oh,
So
yes,
me, I
but
don't like
it
put.
has it. It's
So
included
it's
already.
already in the
Yes,
soap. Oh,
right.
Okay.
And what's good about it is that this is not only for females. I'm a gynecologist. I made this all for the groin and for the labia, right?
Mm-hmm.
But I'm telling you, majority of my patients, they use it for the face, the whole body, even men. They love it. Like, for instance, in the garter area of their underwears, sometimes it discolors because of frequent rubbing.
Yeah.
And you'll be surprised, men buys more than women right now in my
Men,
clinic.
because when we wear briefs,
Yes.
we also have darkening color
Yes.
in the underneath of it. So you can use that.
Yes, it's up to you how you want to use
Okay,
it,
alright.
right? But it's a premium whitening soap, and you can
Alright.
use it in the entire body.
Wow.
Remember, I told you I'm so passionate about this, so I did not compromise the ingredients. I really
Okay.
want a very good product. Remember, my name is there.
Yes, and the packaging is very nice.
Thank
This
you.
is what kind of flowers, when we ask?
Oh, I don't know. It just looks
I
pretty.
think it's
Is it
appropriate.
gumamela?
Yeah, okay. This is not only for the groin, to make it white. Alam niyo na, mga
It's for the entire
maiitim na
body.
singit, but entire body.
Yes.
So you can use it to the face,
Right.
under
Arm.
the arm,
Uh-huh.
and in the groin area.
area,
Okay.
yeah.
What is this product?
Well, this is a premium whitening groin cream. So aside from using the soap, okay, this is a particular groin cream that you apply twice a day.
Premium again. So
Yes.
when it's premium, there is a special ingredients
Yes.
inside. What
Yes.
is the special
The
ingredient?
special ingredients again are the 10 whitening extracts, which is actually different from other
What are the
products.
10 whitening extra? May ganyan pala.
Yeah. This
Kala
is
ko
actually the new
gluta.
thing. No, it doesn't have gluta.
So these are organic
Yes, these are
substance
yes,
or
these are
herbs?
organic substances that are combined to get that effect.
Mhm.
And This has hyaluronic acid as well.
Like this.
Yes,
Okay, like
but
the soap.
it has an addition of vitamin C.
So when they get the soap, they
Yes.
can put
It's
the
good
cream.
to combine with this, so
Ah,
you'll get
okay.
a better effect.
Can you use it in the morning and in the evening?
Yes, you use
Bec-
it twice a day, so you can
Because
use it in the
sometimes
morning
when you
and
use it
evening.
in the morning, it's kind of sticky. No, it's not
No,
sticky.
it's not sticky.
Oh, yeah,
That
maganda
I'm
yan,
very sure of.
kasi may iba kasi they don't like because of the sticky
Right. It doesn't
substance.
have that.
Okay,
It's
good.
like, yeah, very good.
Okay, so meron tayo ha. Hyaluronic
Hyaluronic acid.
and
And
this
this
has
has
10.
10 also with hyaluronic acid and vitamin C.
Okay, vitamin C.
Mhm.
And what is this? This is most
Okay.
interesting.
Well, remember I studied sexual medicine, right? And a lot of
Mhm.
women are looking for this.
Mhm.
This is V.
And you know, just for a teaser,
Mhm.
Jenny and I will be coming up a series of videos. Can we tell them the title?
I think we can.
created
Yeah.
Sex in the Metro. So Jenny will be talking about things of sexual health, sexual, what are what patients or people
Uh-huh.
usually ask.
Right.
Like, there is a perfect vagina.
Oh, yes. I can
If
give
there is a perfect vagina, is there a perfect penis?
I don't know that.
And guess what?
Uh-huh.
The person who will direct us is
Okay.
somebody who is famous. We
Oh,
will
wow.
not tell now.
Yes,
no,
yes.
I already whispered to you.
Okay, yeah, I
So
heard.
guys, as we continue, you watch the series. Okay, Sex in the Metro. Unless there will be changes on that,
Mhm.
then Jenny will be talking about lots and lots,
Yes.
and probably I can contribute on the male aspect. Of
Right.
it. Okay,
That
so
would be
t-shirt yan,
perfect,
ha? Okay.
yeah.
So,
Yeah. Well, this is actually Intimu V-Care Intimate Gel. Okay, this is
so
actually
V
a
is
lube.
for the vagina.
V is for vagina. Intima V.
Intimate.
Intimate vagina.
Yeah, okay.
Don't you like my name?
Yes, because when you like females,
Mhm.
no, we're not biased about the
Yes.
gender, but when aging,
Right.
especially for men and women, especially for women,
Yeah.
sometimes they forget about their, vagina. They forget about
That's
it,
true.
right?
Yes, yes.
Because they say, we're aging, we don't
Right,
care about
right.
it. But this is the time that you made this for them
yes.
to really reconsider and
Mhm.
make their vagina what?
Wet,
Oh, wet,
lubricated.
lubricated. Because
Because remember, when we reach menopause or perimenopause, or let's say you're taking some medications that can cause you to be dry, or even just taking oral contraceptive pills can actually make you dry, or just giving birth, right?
True,
So when
true.
you're actually dry, of course, intimacy is going to be hard, right?
Mhm.
And of course, you want to have pleasure.
Mhm.
So I see this a lot in patients in the clinic, and that's why I actually made a very good lube. And just to share with you what patient says, with this lube, they say that they have a longer playtime.
Okay.
So I
yeah.
think that's good, right?
So this can be utilized by those who are premenopausal or
Yes.
menopausal or young,
Premenopausal,
even young
even
female.
young reproductive age group, they're actually going to
They
benefit
can use
from-
this for
Yes.
sexual contact.
Yes, not only for sexual contact, because remember, for menopausal women, okay,
Mhm.
what happens is that they become very dry. So I even prescribe this 3 times a week.
Can they use this for self-satisfaction?
My answer is yes.
Oh yeah. Oh,
Yeah.
rather than buy the stuff, cream and oil that is not
Yeah.
really. Okay. All right. So we have the Intima V. Yeah.
Right?
And lastly,
oh
we
yes, this
have-
is my most premium product right now. Okay,
Oh.
this is Intima V.
you know,
Rejuvenating
Jenny,
Cream.
all your products have premium
I know.
ingredients, so which I think it's gonna be very fabulous if we
Mhm.
sell it in the market,
Right.
and when our customer starts
That's
buying
true.
it and utilizing it,
Yes.
diba? Maganda yan. So this one is
This is Intima V Rejuvenating Cream. This is used in the vulva. Okay, this is the first one in the country. So far, we don't have any product like this right now. Usually, because I'm a gynecologist, I actually
why the vulva?
the vulva, because patients, what happens with these women when we reach perimenopause to menopause, we use a lot of washes, right?
Yeah.
The vaginal washes available in the market has chemicals. What happens is that they easily get irritated.
Mhm.
Remember, the skin
The
in
lining.
the vulva is
Yeah.
actually very thinned out
True,
compared
true,
to
true.
other parts of the
Okay.
body. So they get a lot of irritations.
Infection?
Infection as well, aside from the irritation, and what else? Like, when they wear pads or
Mhm.
liners, panty liners, they get irritated. And most of the time, they think they have infection.
So they can use this now.
Yes, when they use this, it's going to soothe and moisturize their
Mhm,
vulva, okay?
mhm.
And because of that, they don't need to do all the scratching and irritation and cause a lot of infection
And
as
it can
well.
prevent other infectious
Yes,
diseases within the
that's true. And
superficial
also,
surface of the vulva,
not only
right?
that, it prevents you from having, bad odor also at the same time.
Wow.
It's very good. A lot
So
of
this is for all ages of women.
Yes,
and female.
but I tell you, majority of those who will request for this are the perimenopausal and menopausal age group.
So this age group range from for
Well,
our
okay, where we're looking at 42
Okay.
to 42 and above.
Mhm.
40 and above.
Okay. Can you use this
Mhm.
prior to contact? Can
Yes.
You, also,
Because
like
remember,
this cream
This gel
just
is
gel.
placed inside the vagina.
inside. This one
But
is
this
outside.
One, it's outside,
Ah,
external.
okay. So this is inside. This is outside.
This is
So
for
this
phase
is
number
paired.
2. It's paired too.
Okay. All right.
So it's not only for aesthetic reasons that we do this, but it's also for functional as well.
Okay, okay. So again, guys, you see, we have very fabulous products here. The Intima V. One is the gel and one is the
Rejuvenating cream.
cream. Okay, so this comes in pair. One is external, one is internal. And you have your, again, a soap and a...
This is the whitening groin cream.
Yes, okay. This is for whitening. You can
Whitening.
use this
Yeah.
both male and female.
Male and female.
This can be used by male.
Yes.
Okay. So mga guys, pwede pala tayo. may chance pang pumuti. Oh. But if you don't like your groin, if you think your groin is a bit whitish already, and your
Yeah,
face
wait.
is not, you can put
Put
it.
it on
Joke
your
lang,
face.
joke lang. So,
Yeah,
are
you
you
can put it on your
happy?
face.
Are you happy, friend, that you turn your passion into
This-
something that
I'm
is
actually very
realizing
excited.
it? Okay, excited.
Especially when patients are giving their feedback that they're very happy about it and they're buying by the bulk for personal use. It's so fun, right? And you can see
Yeah.
that there is a big change in them.
Oh.
Just to share with you also, I'm just so happy to share that they're all FDA approved.
Yeah, no.
I think it's very
So
important.
it's
to
very
tell you.
important that it is FDA approved. So this is legit, hindi siya fake. No,
Yes.
we have products that
Oh,
are
we do
fake,
have.
especially online. No? So since we are already promoting this series of products, we have to tell them that this is all certified FDA approved. Okay, any last word, Jenny?
Oh well, if you would like to, you'd like to visit us in the clinic. This is Pelvic Health and Intimate Wellness Center. You can actually find us in the social media, Pelvic Health and Intimate Wellness Center.com. You can order the products as well. You can even order it online, and then our contact number is 0922-825-3266.
All right, so it's 0922-825-3266. Thank you, Jenny,
Thank
my
you
friend.
also.
This is like a random interview,
I
a
know.
random visit to your clinic. But of course, this has been a long overdue.
Oh, yes.
Okay,
I know,
it was
right.
fun, really having a nice, really conversation
Oh,
with
yes.
you, and we
Thank
will be
you.
doing this. You
Yeah,
know, we have
it's
a
very
series.
exciting.
You know, we have a series coming up, and
Yeah.
we will not divulge who the director is.
Of
But
course.
I already told you, it's very exciting. Anyway, again, I'm Dr. Joseph Lee, your friendly urologist, and of course, Jenny Jose
yeah.
will be the friendly urogynecologist and
Sexual medicine expert.
sexual medicine expert. Until next time, with Dr. Jenny Jose.